Hi Lorraine.
Hi Megan.
Nice to see you again.
You as well.
So today I thought we would talk about some different treatment approaches for your chronic pain. Does that sound like a good plan for today?
Sure.
So that's great. First, I just wanted to stress the importance of a multidisciplinary team approach. So I know that's something that you're currently working with, and the evidence really has shown that that's a really effective approach when working with chronic pain. The second option I want to talk with you today is about adding an exercise regime into your treatment. So the research has shown that adding some exercises that are specific to you can really help in your treatment. The third point I want to talk about was ergonomic modifications in biomechanics, which I know sound a little clinical, but when talking about ergonomic modifications, that would just be simple examples like, I know for work you wear a strapped backpack with your nail, so that's on one side of your body, and it's an uneven weight distribution, so by having two straps or something like that, that keeps you more balanced. So little modifications like that in your daily life. And the second one I mentioned for biomechanics instructions would be just keeping your body in a healthy alignment and making sure you're not straining any areas of your body. So I know you pick up a lot of packages when you go door to door. So for example, it would be like squatting down to pick up a package instead of bending over and hurting your back. So those were the options I want to talk about to you today. And the last thing I wanted to mention was the focus on your individual experience. So the research does show that, and I'm sure you know, that chronic pain is very individualized, and the way you perceive it is going to be different than anybody else. So really focusing on what works for you. We may try a couple things to see how it's going. I just don't want you to get discouraged and think that one treatment's going to work for you because it works for all these other people. So it's really, really important that your interests, your values, your daily routine, those are taken into consideration. So I do have this little concise pamphlet for you to take home. So it just goes over the different options we talked about today. You can take it home, look over it in detail, talk about it with your family, and we'll talk about it next session.
Okay, great.
Do you have any questions before we end today?
Nope, just excited to get started.
All right, sounds great.